Thank you very much, and thanks for the privilege to provide some opening remarks for this webinar series on prioritized One Health zoonotic disease in Somalia. I would like to acknowledge the World Health Organization and Abrar University's One Health Center for this great initiative to advance the One Health approach and concept in Somalia. As my colleague, the WHO representative, just mentioned, emerging and re-emerging zoonotic disease pose a threat to both humans and animals. Most known human infection diseases and about 3/4 of newly emerging infections originate from animals. In Somalia, the effects of this disease threaten health security, contribute to food insecurity, and weigh on the economy and government resources. The impact of emerging and endemic zoonoses on human and animal populations makes their control and prevention a natural starting point for collaboration between humans, animals, plants, and their shared environment. Hence, environmental health is critical for the health and well-being of human, animals, and plants. Water, air, and soil pollution can also have adverse health outcomes in humans, animals, and plants again. To achieve a sustainable outcome that envisions reduced health, social, and economic impact of pandemics, it is imperative that all stakeholders across the animal and human health sectors, as well as environmental health, are involved actively and in an inclusive manner to aggregate resources, skills, and efforts towards one common goal. As collaboration efforts progress, identifying zoonotic diseases priorities of jurisdictional importance to governments and institutions becomes critical. It is therefore vital that coordination structures at all levels are strengthened, government-led, and flexible to adapt to evolving context. Given this consideration, in March 2023, Somali experts from human, animal, and that includes livestock and wildlife, and environmental health sectors prioritized the 7 top zoonotic disease of great importance using the multi-sectoral CDC One Health zoonotic disease prioritization process tool. The zoonotic disease prioritized were Rift Valley fever, Middle East respiratory syndrome, and anthrax, trypanosomiasis, brucellosis, zoonotic enteric parasites, and avian influenza viruses. As we have witnessed in recent years, such as the West African Ebola epidemic. It is therefore critical to strengthen regional approaches and partnership for their control, minimizing threats to safeguard the health of all. In Somalia, we know that uncontrolled zoonotic outbreaks can have a direct and devastating impact on vulnerable and food insecure rural communities. Learning from the COVID-19 pandemic, enhanced cross-border collaboration is pivotal and should serve as a model precedent to build upon and scale up, particularly in the areas of joint information exchange, response, and harmonization of resources for the common detection, prevention, preparedness, and response capacities of identified zoonoses threats of mutual concerns between countries. Among the cross-border initiative is the recently established technical working group led by WHO to foster cross-border collaboration addressing public health threats. The technical working group includes human, animal, and environmental health experts and stakeholders involved in managing public health events at points of entry. FAO takes pride in playing a major role in supporting multi-sectoral cooperation to strengthen the institutionalization and operationalization of One Health in Somalia, which has culminated to the establishment of the One Health National Technical Working Group in Somalia. The group consists of federal ministries in charge of human, animal, plant, and environmental health, and will provide guidance on the development of a long-term strategic approach to reducing the risk of zoonotic pandemics and develop synergies needed to institutionalize and implement the One Health approach including in areas that drive pandemic risk. To end on this note, I commend the Somali One Health Center of Abrar University and the WHO on this initiative to raise the profile of One Health concept in the Somalia context. I also encourage research partners, students, health profession, and decision makers to participate and share this webinar series to further disseminate the lessons learned here of One Health action in Somalia.